Hello everybody, I'm Nicola Maffulli. I'm the professor of musculoskeletal medicine and a consultant orthopedic surgeon both in Salerno, Italy and in London, UK. In the London Olympics, I was put in charge of two things. One was to sort out the foot and ankle services for the whole of the Olympics and the Paralympics, and above all, to set up the medical services for wrestling and judo. Today, I will tell you how to examine a patient. Today, I will tell you how to examine a wrestler in order to okay him or her for participation in the tournament. The rules of FILA are very strict. Before the tournament, each and every single wrestler has to be examined in order to ascertain whether they are able or not to take part in the tournament itself. Each wrestler should have the wrestling passport. This is a health passport which should be okayed by their local national federations in order to be able to participate. What you will find is that as the tournament doctor, you are not under FILA rules, you are under IOC rules. And you will find that you will be under great pressure in order to pass all the athletes. Please remember that the health of the athlete eventually depends on you, and therefore you have to be strict and fast in that examination. Each weight category will be examined the day before the tournament itself, and in each day you will have to be able to examine 2 or 3 weight categories. The thing that I recommend is that you have an assistant with you, so that they will be able to sort out the paperwork, and you will be only doing the actual examination and the questioning of the athlete. The assistant will have to sort out the paperwork and therefore have a look at the passport and make sure that all the rules are followed. For example, the athlete will have to be examined within a given number of days before the tournament by their national federation in order to be able to compete. Also, the fact that you will have an assistant will allow you to be compliant from a medical legal viewpoint, and in this way, any dispute that may arise will have the presence of a witness who will be able to tell a third party what is happening. On this occasion, we have Lefteris close to us. Lefteri, on this occasion, is not a wrestler, but is a mixed martial artist. And he has to have similar examinations to what we have to undertake in wrestling. Obviously, you have to make sure that Lefteris is able to see properly and is able to withstand the strains and the stresses imposed by wrestling competition. I will focus also on some of the dermatological issues that may arise. There are conditions which are transmittable, skin conditions which are transmittable, and therefore you have to make sure that the wrestler is not affected by them. Well, I would normally start by having the wrestler standing in front of me, and I ask them to follow my finger without moving their head, making sure that they have good eyesight and they are able to follow what happens in front of them. I have a look at them from the front and from the back, making sure that they don't have, for example, herpes glaviorum. They don't have other skin diseases that may lead to this. Please have a look at their axilla as well, to make sure they don't have any suppurating hydroxyadenitis, for example. The whole examination does not need to be long, and you can palpate the bony points to make sure that everything is fine, and ask the athlete whether they are hurt. You okay, Lefteris? Okay. Thank you very much, Lefteris. You can go from the front and from the back from this place. Wrestling is a contact sport. It may happen that some of these athletes may have experienced pain because of costal injuries, rib injuries. What I normally do is I compress the rib cage and ask the wrestler to breathe in and out. Lefteris, can you breathe in and out? Any pain? No? No. You can do it at different levels, because you have to make sure that there is no rib injuries. You can imagine that If a rib is fractured and left teres is involved in a wrestling move, the rib itself can penetrate the lung and therefore cause a catastrophic injury. I also have a look to see whether there is any open wound anywhere, and it looks to me as if left teres doesn't have any. There's no open wound, therefore there is no risk of infection. You cannot really do much more than this, and your examination is really a short to the point examination. You will be under pressure because normally you have in the region of 1.5 to 2 minutes only to examine each athlete. And normally the examination is performed at lunchtime, in between the lunch break, in between the morning and afternoon resting session. You may also want to palpate the spinous processes of the spine, of the whole of the spine, in order to make sure that there is no problem. If there is no problems that way? No? Okay. Many wrestlers will have cauliflower ears. In this case, left teres probably has not been involved in as many fights, and he doesn't have them. But please make sure you palpate the ears as well, and make sure that they are not painful, because obviously this could be deleterious to their performance on the mat. It is nice and straightforward. Please remember that nowadays there is also female wrestling, and especially when you are examining lady wrestlers, make sure that you have a witness in front of you, again for medical legal purposes. Thank you.